I get tested for STDs regularly, so does everyone I work with.
Since I'm guessing you don't take their word for it, all right, I'm gonna need you to lie on your side and put your knees to your chest. Any history of alcohol or substance abuse?
My wife used to smoke a little pot, but I never touch this stuff.
You're married.
Happily. For 2 years now.
She happy you do porn?
Very. Since she does it too.
You ever get jealous when your wife's working?
It's a job. Once you start letting your work life rule your home life, especially if you're in the same line of work, your relationship's gonna be short.
You feel a little pressure. Any history of sexual abuse?
I defy the cliche.
Have you ever suffered depression or psychosis?
Save you some time. There's not a blotch on my medical record. Look, I know most of the people in my field are drug addicts with daddy issues, but I'm a nice Jewish boy from the burbs. I wasn't driven to this. I chose it. I believe in it. I actually think it's... Oh, my arms are killing me.
It's like tetany. Your muscles are contracting.
Oh.
Need some paradine in here.
Oh, God.
So you guys actually work together?
We did it first, but now we like to keep our films pretty separate.
So do you watch her work?
We're both busy with our own stuff. Think what you want, but we're proud of what we do.
Divorcing sex from all emotional content?
Emotion is emotional and sex is mechanical. It doesn't really need to be any overlap.
Certainly not in your world.
We've helped a lot of couples by taking sex out of some deep, dark dungeon. You do what you want without some big moral comeuppance.
You think you can escape the consequences, but you can't. You don't get to make your own rules and morals.
Well, you're here to treat him, not lecture us about her. Hank, are you all right? Are you okay?
Just a nosebleed.
Inside his leg? Tracheal hemorrhages.
We were wrong. So was Foreman.
Patient's blood won't clot. Back to square one.
You're back in my office. So much for playing hard to get.
We're just here to help Foreman.
Is that?
He's not without talent.
UV rays made the patient's capillaries more fragile, hastening the onset of DIC. Sounds like sepsis.
It isn't. No sign of shock, no drop in blood pressure.
Can we turn that off?
Right, because Cameron thinks pornography is evil.
I don't care what he does. I don't care what you watch. I just think it's annoying that he pretends it's some beautiful life we should all be aspiring to.
The shift points to bacteremia.
No fever. Plus, it wouldn't explain the spasmodic muscle contractions.
The ball and chain smacked you down.
But widespread petechial rash, nervous system involvement. It's some kind of blood infection. Meningococcemia.
Start the patient on heparin for the DIC, broad-spectrum antibiotics for the meningococcemia. Dr. Cameron. Chase is relaxed, at ease, in lockstep with you again. I guess he finally told you that he iced Idi Amin Jr. Does that mean he can break the other 9 commandments too? Taking the Lord's name in vain, sure, but coveting thy neighbor's wife? Is she hot?
I've forgiven him.
Not for murder, not you. Doesn't matter how evil Dibala was. By every conscience-hugging, Mother Teresa-loving bone in your body, you should be leaving him, not leaving with him.
I thought your position was our leaving is a ruse.
We're not talking about my position, we're talking about yours, which doesn't add up.
Here's what doesn't add up. If you were serious about staffing your team, you would know exactly which 3 fellows you wanted. You plowed ahead with this case, even though you hadn't hired new fellows because you knew Foreman would ask Chase and me to help, giving you more time to blow up our marriage.
I don't want that. But we'd be foolish not to plan ahead. A, my firing Chase was the only reason you left 2 years ago. B, when the full horror of his homicide hits you, your marriage will blow up. And Z, the only obstacle to you working here will be gone. Or maybe I skipped a couple of letters.
Meningococcemia spread person to person. Something you ought to think about next time you show up for work.
It's okay. Your wife's not here.
I'm just telling you what
You have to lecture me when she's around, I get it. But I can tell from all the questions you ask that you're more like me than you admit.
I'm a guy. I look around every once in a while, but I love my wife. I love the fact that she's the only one that I'm intimate with.
And no part of you wants to just toss this rule book everyone's forced on you.
And part of you wants a life of actual commitment?
Is my relationship perfect? No. Am I ever horny when my wife has just had sex for 9 hours? Yes. But we are committed to each other in every way that matters.
In other words, you're committed except when you're not committed. Doesn't work so well if you have a conscience.
Conscience. You mean that thing that kicks in when there's no logical reason to behave the way people want you to? What?
You have a fever. Means the antibiotics aren't working.
I owe you an apology. I was.
What were you wrong about?
You spent weeks elaborately concealing the fact that you crashed Daddy's car. And then you just confessed. It seemed idiotic. It turned to end in disaster. Instead, you're riding off into the sunset together. Any theories on why?
I assume you've already dismissed the she loves me theory?
Possible. It would require the presupposition that everything she's done for the last 6 years has been completely inconsistent with her character, but yeah, it's possible.
As we've already established, it's also possible that you're wrong.
Or there's another explanation. Since you don't have one, I'm gonna keep looking for you.
Let him drain the packet with anesthetics and sterile gauze.
We don't know how much the sclerosing cholangitis has damaged your liver. It might be in a year, it might be in 10. But the odds are you're gonna need a new one. And you should know, while no transplant committee will say this openly, they'll never grant an organ to someone working in your profession.
You're saying I have to change jobs? You're medically advising me to change jobs.
Hank, if you're too
She
sick.
wants me to have some kind of religious conversion. She's practically salivating over
I'm
it.
just being candid about
Well, so you don't think I'm scum? Just some committee thinks I'm scum.
that your lifestyle has risks.
You work around more sick people and germs and blood than I do. I'm not gonna live my life afraid like my parents did. Barely letting me play outside, and God forbid that I get a scratch.
I'll talk to him. He'll calm down and realize that this is the only...
No, I won't. Why does everyone want to dictate the way I live my life?
Because the way we're living it is gonna kill you.
Passing the pancreatic duct.
Don't listen to House.
You have no idea what he said.
I know that House is manipulative. I know that you're in a vulnerable state right now. And I know that Cameron wants your marriage to work. So do you. So don't listen to House.
House doesn't make my decisions. I'm in the common bile duct.
What's that mass? Gallstone?
Can we magnify ×5? That's not a gallstone.
His liver's completely filled with worms.
You have strongyloides, also known as threadworms. They disseminated all over your body, causing all your symptoms.
How'd I get a parasite?
Most likely through sexual activity, but we can't be sure.
And what's the treatment?
2 mebendazole pills.
That's it?
You'll be fine. Your liver too. Go back to your lives.
You okay?
Getting through it?
It'll be a lot easier once you two are away from here.
Yeah.
He's peeing blood. BP's rising.
Heart rate's up to 250. He's going into cardiac arrest.
Charging. Clear.
He's bleeding out.
His body's completely giving out. Charging. Clear.
Why are you here?
Because I think we're wrong, which means something's gonna go wrong. All right. Takayama here.
It's me and 13. Stop the ablation.
Because
Those threadworms. Why would his body have gone to hell just hours after they were gone?
The worms weren't hurting him. They were helping him. He has extra-intestinal Crohn's. He got it from being raised in too clean, too overprotective of an environment.
It's the hygiene hypothesis. Why there's so much autoimmune disease in the developed world and almost none in the developing world.
The worms were keeping the Crohn's in check, teaching his immune system what it should have learned from eating dirt growing up.
Once you killed them, it started killing him.
so his life of filth wasn't the problem. The clean living was. Let's start him on methylprednisolone.
And some helmets.
Worms. Cool, huh? Best out of 3?
Still drawing those lines instead of looking at the cards.
More juice?
What's more juice? He has to ask for it. Adam? Buddy, I's here.
He's tired, Dom.
Wouldn't be if we stuck to the schedule. Show me the juice, buddy.
I think we've reached the point of diminishing
He has to
returns.
ask for it. Adam!
He's choking.
It's impossible. It's mac and cheese.
I'm sorry, you can't come in here.
What's going on?
1, 2, 3.
Is it Fifi?
There you go. Charge.
Clear. Charging. Clear. Charging. Clear. Charging. Clear.
He's stable for the moment. First degree atrial ventricular block.
Okay. What else do we know?
His liver's damaged, pleural effusion compromises lung function.
Biopsy was negative for cirrhosis. Parents didn't poison their son.
It's not his liver, his heart, or his lungs. It's the calcium carbonate in his stool.
Kid was constipated. Parents probably just overdid it.
Or they didn't do it at all. Calcium carbonate's also what's in chalk.
So he ate some chalk. It isn't toxic. Sure, it didn't cause a pleural effusion.
Forget the chalk.
You just said it was about the chalk.
Yes, and then I said forget the chalk. He must be very confused. This kid's got pica. Take him to a buffet. He's gonna eat the table.
Or lead paint.
Level of lead in the blood was normal. His tox screen was clean.
We're not looking for typical poisons. We're looking for anything that he can put in his mouth. Matches, spiders, bricks.
Pressure-treated wood used to contain arsenic.
Even better. Hansel, get samples of the gingerbread house. Bag everything. Ever see your son eat a bush?
I haven't.
I've only ever seen him eat with
Adam, you ate something at your house. Something that made you sick. I need you to show me what you ate.
Can't answer you.
Neither can you. This is your backyard. You may know it as Mel's Diner. This is your sandbox, your jungle gym. And under it is this. I need to know if you ate this, Adam.
He doesn't know what you want.
Adam, you have to tell me. Because if you don't, it'll be game over. You'll be dead.
What the hell are you doing?
Show me what you ate. Adam, show me what you ate.
Adam?
Honey? Adam?
Come on in, brothers and sister. Welcome to the house of the Lord.
House, come on. The chapel?
We have been blessed with the miracle of a new symptom. Brother, can you testify as to why this poor child's eyeball rolled back into his head?
It's consistent with Jimson weed poisoning, ocular paralysis. Sorry.
The wicked shall deceive you because they have turned from the Lord and are idiots. His ocular muscle didn't paralyze, it pirouetted.
MS.
It is easier for a wise man to gain access to
Can you
heaven.
stop doing that? Just say not MS.
Stroke. Bleed in the brain.
Be seeing other symptoms besides a single eye misalignment, like a coma. You've already testified.
It's a tumor.
And all the imaging just missed it?
It's a microtumor. It started in his lung, which caused a pleural effusion. Then it metastasized to his liver, which made it slough cells. And then went to his brain, behind the eye, which caused it to roll back into his head.
So he has 3 tumors, and we missed all of them. What's the opposite of a miracle?
I have a better chance of finding it now that I know exactly where to look. So, unless you have a better idea, I'm gonna go CT his head. And then if I have to, remove his eye.
You remove this kid's eye, he's only gonna be half as good at not making eye contact.
Don't touch his eye.
This is an appendectomy.
Like I said, don't touch his eye. Why isn't he in surgery?
Some emergency bumped him. We've got another room in 10 minutes.
You're not taking him in. Kill the lights. Keep seeing them all the time.
What are you looking for?
He's telling us what he was seeing, telling us exactly what was wrong with him, drawing them for us over and over again. But nobody knew how to speak autistic. I asked him what he ate. He even told me that.
What are you talking about? What was he seeing?
Hello, my buddies. It's not a tumor, Foreman. It's worms swimming in his eye. Animal makes potty in the sandbox. Boy plays in the sandbox. Boy eats the sand. You can probably tell where this is going by now.
Stool samples were negative for parasites.
Raccoon roundworms are not excreted by their human host.
Cameron tested the sand.
All of it? Worms spread from his gut to the rest of his body. They attacked his lungs. That's what made him scream and caused the effusion. They invade his liver, sending dead liver cells coursing through his system. They attack his eye and the muscles surrounding it, making his eyeball do a backflip. Laser photocoagulation to fix the eye and a high dose of benzimidazole to kill the worms.
Wait a minute. That's it? He's gonna be okay?
Good news. He's gonna be with you for a long, long time.
This is Sandy Glenn and her husband, Drew. Passed out in her home this morning, GCS 15, vital stable.
I'm Elsa Curry, third year medical student. Can you tell me what happened?
I was just making some tea, then suddenly I saw stars.
I found her on the floor.
Has this ever happened before?
No.
But she does have multiple sclerosis, relapsing remitting. Could it be the start of a new episode?
Yeah, it's possible. Any other symptoms, visual disturbances, pain, incontinence?
No, nothing like that.
Okay. Transfer on my count. 1, 2, 3. Okay. Yeah, you've also got some dry skin, marked pallor, and some peripheral edema. Have you been losing any weight?
Maybe a little, but not much.
All right. Then my attending and I are going to order a full set of labs and have Neuro come down to take a look. I'll be back in a little bit.
Okay, so anemic, hypoglycemic, low vitamin B12 and calcium, EKG changes. Ain't good. But it doesn't look like an exacerbation of her MS.
No, it looks like anorexia, but she's not underweight.
Which doesn't necessarily exclude the disorder. Let's go say hi. I'm Dr. Charles. Miss Curry wanted me to say a quick hello.
Were my test results bad?
We're worried about your nutrition. Have you been experiencing any digestive issues or decreased appetite?
No.
No? Okay, that's good. Are you concerned about your weight at all, or even, say, your appearance in general?
I'm not anorexic. I have a tapeworm.
A tapeworm?
Yes, I infected myself on purpose for my MS.
There's this thing called helminthic therapy.
Yeah, for autoimmune diseases, it's really cutting edge.
You've heard of it?
Yes, basically the hypothesis is that a worm infestation can activate your immune system to fight against certain conditions. You know, there's actually quite a few centers that are doing clinical trials.
She couldn't get into any of them.
Have you discussed this with your neurologist? Because there are several new therapies for MS. Immunomodulators.
Steroids, Cytoxin. I've tried everything. But since I started this, I haven't had an episode in 3 months.
Really? Okay, what is your normal remission rate? Because anything longer than 2 standard deviations, and we could probably publish a case study.
Could you excuse us for a second, Miss Curry? Listen, Miss Curry, I appreciate your enthusiasm, but these trials are held under strict medical supervision. She's doing it on her own.
I know, but this is the front line of immunotherapy. I mean, we could find a positive result.
That woman passed out today from malnourishment. That's what we're treating here.
Or we can work with her. We can modify her diet. We can give her higher calorie
The
food.
patient has a parasite, and it is clearly undermining her health.
Dr. Charles, I really...
Let's start with 400 milligrams of albendazole and hang a liter of D5W. Thanks.
Okay, so if you email me the details, I'll follow up with you in a week, and we can take it from there.
Miss Curry? What are you doing?
She wanted to be discharged.
She's severely anemic. She could pass out before she gets to the parking lot.
I mean, I scheduled a visit with a nutritionist, and I'm going to monitor her closely.
Miss Glenn, you're aware that this worm puts you at risk of pancreatitis, heart disease, arrhythmia?
I know, but it's the only thing that's helped my MS.
Trust me, correlation is not necessarily causation.
What does that mean?
He doesn't think that the absence of MS symptoms is related to the tapeworm.
Not what I said. Whether it's helping you or not, The side effects are seriously endangering your health.
I don't agree. I know how I feel, and I'm going home.
Well, then I'm sorry you leave me no choice but to put you on a psych hold.
What?
You can't make her stay here.
I'm afraid I can. Right now, your wife is a danger to herself. My job is to protect her. Earl, back and forth.
No, Dr. Charles, what are you doing?
Come with me, ma'am.
Hey, hey, what are you doing? What are you doing?
Here.
Dr. Charles,
You can't keep me here.
Get off of her.
Mind if I come in?
Not at all.
You okay?
Oh, you mean that whole thing down there? I mean, I wish I hadn't come to that, but, yeah, I'm fine.
Didn't look that way to me. You know, we've worked together a long time, Daniel. You usually empower your patients to make their own choices. Putting that woman on a psych hold?
Sharon, I made a clinical decision for her own well-being. Don't know what to tell you.
Look, I know watching Cece go through treatment has been very hard on you. It's making you feel a little helpless. But bringing your emotions to work?
It's outrageous. What recourse do we have?
My husband's talking to our lawyer. We're going to sue you.
That won't be necessary. I'm releasing the psych hold. You can go home.
What?
I'm discharging you. You're free to go.
Okay.
Well, good luck. Hope you feel better. Follow up with the neurologist. Stay on top of those labs and, keep me updated as to our progress.
Of course.
Thank you.
What's up, Miss Ruby?
You're late.
I am. I'm gonna catch up in the OR.
Don't rush. And don't accidentally cut anything you're not supposed to cut.
I won't. That's a good tip. I promise.
Do you know what Dr. Cole's going to be doing today?
He's gonna cut a worm out of my brain.
It's called an echinococcal cyst.
A worm.
A worm.
Yeah, it's a worm.
I still can't believe this is actually happening. I should have never taken her to Japan.
No, Japan's cool. Traveling with your dad, that's awesome. Even if you left with an inconvenient souvenir.
Ruby. Oh, nice of you to show up.
Yeah, sorry, things got a little complicated in the field. Hi.
Dr. Cole, you're rushing again.
Yeah, I am.
You're always rushing.
Hang on a second. You know what? You're right. And I'm really sorry. I'm gonna stop rushing right now, okay? You have my full attention.
Guys, 2 minutes till we lose our OR spot.
I'm here and I'm yours. Got it?
Promise?
Promise. You ready?
Yeah.
Okay. All right, let's go. More irrigation, please.
You and I have a mutual friend in town.
Forceps?
Mark Gower from Minneapolis.
Damn it. Cyst is wrapped around the optic nerve. Check evoke potentials.
Apparently you and he worked at the same lab.
Can we concentrate on Ruby here?
Optic nerve intact.
Okay, here's what I'm gonna do. I'm gonna dissect the nidus 1 millimeter at a time while you check the optic nerve function and make sure she preserves her full visual field.
Pressure's dropping. Sets down to 82.
Benadryl and epi, now she's anaphylaxing.
To what?
The cyst content, the fluid's leaking, causing a massive inflammatory response.
Systolic's only 57. She's getting her to bag.
Pulmonary edema. Look, it's only gonna get worse unless we get that cyst out of there.
Check the optic nerve again.
Now forget the optic nerve, pull the cyst out or she'll code.
I can't do it.
What do you mean you can't do it? Her pressure's dropping, her sats are in the 70s. Pull out the cyst or she'll arrest.
If I do that, she'll go blind.
Well, blind is better than dead, Jason.
No. Give her 30 prednisone, start epinephrine, and a dopa infusion. We attack the anaphylaxis. Once she's stable, we will come back in and we'll do this properly. I promise Ruby I wouldn't rush.
You need something?
Yes, a YAG laser.
We have one.
Not with a short wavelength. I've got a little girl with a cyst on her optic nerve, and I can't even get close to it without potentially blinding her. However, in Germany, they're experimenting with a low-frequency laser. I think it could be perfect.
Too bad we're not in Germany.
Well, maybe we can get compassionate use approval and bring it over.
Even with emergency approval, to buy this and get it over here, that's $100,000.
What if it was your daughter?
You really went there?
I did.
I'll see what I can do.
Thank you. Here we go. Hey, kiddo. How you doing?
Okay.
Good. Well, you sleep tight, all right? I'll see you when you wake up.
Okay. But will I see you?
Of course you will. I promise.
Okay, Ruby. I need you to count backwards for me. 10,
9, 8, 7.
How did you get the board to reconsider the laser?
I didn't. Someone sold a certain Italian sports car, made a donation with the proceeds.
No.
Amazing what money can do, isn't it?
The scolex of the worm has these tiny hooks embedded in the optic chiasm. Slow wavelength should knock the little sucker off without damaging any of the surrounding structures. Let's increase the amplification slightly. A little more irrigation. Good. Okay, suction and forceps.
Gotcha.
all this for one little parasite?
Oh, parasite can do a lot of damage.
Evoked potentials look good.
Scolex out, vision is intact. It's very nice work, everybody. Let's irrigate. Close her up.
You still haven't figured out that I don't need sedation?
So you don't move during the procedure.
Is that nitrous? What, are you trying to kill her? I gave her nitrous during the EEG. That's what made this thing rear its ugly.
What thing?
B12 deficiency.
Are you having deja vu? We've had this conversation. She was given B12. She didn't get better.
Because someone else ate it. Get an abdominal MRI.
What? What are you doing? Don't touch me!
See? There she goes.
Don't touch me!
The paranoid delusion. Marichi's going downhill. Forget the MRI. We need an OR.
Let me help! Occupy!
Her hernia can wait.
Help! They're trying to kill me!
Okay, you can either believe that we really are trying to kill her, or you can assume that she's suffering from a medical condition. Seeing as this is a hospital and we're all dressed like doctors and there are easier ways to kill somebody.
Bev, help them.
I'm gonna need iodine, scalpel numbers 10 and 15, forceps, and a largish salad bowl. Okay, hold her down. Come on, weenie, she's in a cast. Swap. 15.
You're not going to anesthetize her?
Relax, it's just a magic trick. She's faking it. We're not falling for it this time. Okay, keep that retracted. Forceps.
Lake fishing can be fun. It can bring the generations together.
If you don't cook that trout or perch well, you'll be giving room and board to this fella. By free board, I mean all B12 you could take in.
I could have a tapeworm in me?
Not likely. You'd be in a lot of pain. It's gotta be 25 feet long. Damn it. World record's over 60.
It's a lesion.
And the big green thing in the middle of the bigger blue thing on a map is an island. I was hoping for something a bit more creative.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
everybody lies.
Dr. Haas doesn't like dealing with patients.
Isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
So you're trying to eliminate the humanity from the practice of medicine?
If we don't talk to them, they can't lie to us. And we can't lie to them. Humanity is overrated. I don't think it's a tumor.
First year medical school, if you hear hoofbeats, you think horses, not zebras.
Are you in first year medical school? No.
First of all, there's nothing on the CAT scan. Second of all, if this is a horse, then her kindly family doctor in Trenton makes the obvious diagnosis and it never gets near this office. Differential diagnosis, people. If it's not a tumor, what are the suspects? Why couldn't she talk?
Aneurysm, stroke, or some other ischemic syndrome?
Get her a contrast MRI.
Creutzfeldt-Jakob disease?
Mad cow. Mad zebra.
Wernicke's encephalopathy.
No. Blood thymine level was normal.
Lab in Trenton could have screwed up the blood test. I assume it's a corollary of people lie that people screw up.
Redraw the blood tests and get her scheduled for that contrast MRI ASAP. Let's find out what kind of zebra we're treating here.
I don't feel so good.
It's all right. Just try to relax.
Rebecca? Rebecca? Rebecca?
Get her out of there.
She probably fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there.
Just be another minute.
She's having an allergic reaction to the gadolinium. She should be dead in 2 minutes.
Hold her neck.
Oh, she's ashen.
She's not breathing. Epi 0.5.
Come on. I can't ventilate.
Too much edema. Where's the surgical airway kit?
Yep, coming.
Good call.
Steroids. Give her steroids. High doses of prednisone.
You're looking for support for diagnosis of cerebral vasculitis.
Inflammation of blood vessels in the brain is awfully rare, especially for someone her age.
So is a tumor. Her SED rate is elevated.
Mildly.
That could mean anything or nothing.
Yeah, I know. I have no reason to think that it's vasculitis, except that it could be. If the blood vessels are inflamed, that's going to look exactly like what we saw in the MRI from Trenton County. The pressure's going to cause neurological symptoms.
Can't diagnose that without a biopsy.
Yes, we can. We treat it. If she gets better, we know we're right.
And if we're wrong?
We learn something else.
I can't see. I can't see.
Little help in here! It's not a tumor. She's getting worse too fast. She can't stand up.
No toxins, no medications?
Nothing that would explain these symptoms.
Family history of neurological problems?
Not that I can tell from her underwear drawer.
You said nothing that would explain these symptoms. What did you find that doesn't explain these symptoms?
Dr. Wilson convinced you to treat this patient under false pretenses. Adler's not his cousin.
That's ridiculous. You can ask her yourself. Can we get back?
She's not Jewish.
Rachel Adler's not Jewish.
I had ham at her apartment.
Dr. Foreman, a lot of Jews have non-Jewish relatives, and most of us don't keep kosher. I can see getting through high school without learning a thing about Jews, but medical school?
Okay. Maybe she's Jewish, but she's definitely not your cousin.
Really? This guy's...
You don't even know her name. You called her Rachel. Her name is Rebecca.
Yes. Her name is Rebecca. I call her Rachel.
You idiot! Listen, he said not you, him. You said you didn't find anything.
Everything I found was in
You
my...
found ham.
So?
Where there's ham, there's pork. Where there's pork, there's neurocystic cirrhosis.
Tapeworm? You think she's got a worm in her brain?
It fits. Could have been living there for years. Never occurred to me
Millions
because...
of people eat ham every day. It's quite a leap to think that she's got a tapeworm.
Okay, Mr. Neurologist. What happens when you give steroids to a person who has a tapeworm?
They get a little better and then they get worse.
Just like Rebecca Adler did.
In a typical case, you don't cook pork well enough, you digest live tapeworm larvae. They got these little hooks, they grab onto your bowel, they live, they grow up, they reproduce.
Reproduce? There's only one lesion and it's nowhere near her bowel.
That's because this is not a typical case. Tapeworm can produce 20 to 30,000 eggs a day. Guess where they go?
Out.
Not all of them. Unlike the larvae, the egg can pass right through the walls of the intestines into the bloodstream. And where does the bloodstream go?
Everywhere.
As long as it's healthy, the immune system doesn't even know it's there. The worm builds a wall, uses secretions to shut down the body's immune response and control fluid flow. It's really very beautiful.
As long as it's healthy. So what do? Call a vet, nurse the little guy back to health?
It's too late for that. It's dying. And as it dies, this parasite loses the ability to control the host's defenses. The immune system wakes up and attacks the worm, and everything starts to swell, and that is very bad for the brain.
There could still be 100 other things. The eosinophil count was normal. It's only abnormal in 30% of cases. Proving nothing.
Oh, no. You see, it fits. It's perfect. It explains everything.
But it proves nothing.
I can prove it by treating.
No, you can't. I was just with her. She doesn't want any more treatments. She doesn't want any more experiments. She wants to go home and die.
I think we can prove it's a worm. It's non-invasive. It's safe. I'm not completely sure, but I thought of it.
What's the damn idea?
Have you ever seen a worm under an X-ray? A regular old, no contrast, 100-year-old technology X-ray. They light up like shotgun pellets, just like on a contrast MRI.
Which is the same thing as a CT scan, which we did, which proved nothing.
Worm cyst is the same density as the cerebrospinal fluid. We're not going to see anything in her head. But Chase is right. He's right. We should X-ray her, but we don't X-ray her brain. We X-ray her leg. Worms love thigh muscle. She's got one in her head. I guarantee you there's one in her leg.
Hold still, Rebecca.
This here is a worm larva.
So if it's in my leg, it's in my brain?
Are you looking for a guarantee? It's there. Probably been there 6 to 10 years.
Do I have more?
Probably. It's good news.
What do we do now?
Now we get you better. Albendazole.
2 pills.
Yeah, every day for at least a month with a meal.
2 pills?
Yeah. Possible side effects include abdominal pain, nausea, headaches, dizziness, fever, and hair loss. We'll probably make you keep taking the pills even if you get every one of those.